Hello, I am here and I'm Cassandra. I am the Director of Public Relations here at Platte River Foot and Ankle Surgeons. And I'm going to interview Dr. Waters here a little bit about bunions today. And I was just gonna ask him a few questions as far as how common are bunions?
Super common. I think the literature shows that up to 40% of the population has bunions. So it's one of the most common deformities that we treat here at Platte River Foot and Ankle Surgeons and in the foot and ankle world in general. More common in women, for sure, definitely more common, probably 2 to 1 in women versus men. And like I said, up to about 40% of the population could be mild somehow, and then others have more moderate or very large bunions, but it's a very, very common foot deformity.
Okay, what are some treatment options for bunions?
So, I mean, typically treatment for bunions kind of evolves into one of two things. One is you have the deformity, and we say you accommodate for the deformity. So when you accommodate for deformities, you're just going to wear shoes that the deformity fits inside of. They make bunion pads and splints. You treat the pain associated with the deformity, whether that's like a topical gel or a number of things. So that's one option. And then of course the other option is to actually fix the deformity. And in order to fix the deformity, that's where we delve more into the surgical side of treatment.
Okay, so going back to shoes, what types of shoes are good for bunions?
So, I mean, I think the biggest thing is it's got to be wide. You know, the bigger the bunion deformity, the wider the shoe is. The thing that often causes pain with patients as far as shoes and bunions is that the shoe starts to rub against the bunion deformity. And so I think, you know, great shoes in general are things like New Balance, Brooks, Asics, Saucony. Hoka is a brand that's come on lately. Merrill is another good brand. Skechers, a lot of our patients wear Skechers and love them. So, but I think inside of any of those brands, the trick is you've got to get something wide enough. So you might have to special order it depending on how big the bunion deformity is. But going to like a shoe store like Brown's is a great place here in Hastings where they could actually measure the width of the foot. And then you could even go a size bigger on the width to accommodate for the bunion deformity. But I think that's the tricky part of bunions. And then as a side to that, I think inside of the shoe, really having the appropriate arch support. So whether that's with an orthotic, which we do those here, or, you know, a shoe that has a real good built-in arch support, it would be critical as well.
Great. What are some surgical options that you can do for bunions?
So when the bunion's, you know, painful or, you know, you can't find shoes that you fit in anymore, I think that's the time to discuss surgery. And I think there's been over 200 surgeries invented or written about for bunions. So there's a wide variety. But, you know, the bottom line when it comes to surgery, it really evolves usually into two things. One, we can either cut the bone and reposition it, or we can do some kind of a fusion of one of the joints that's involved in the deformity. And so either one of those is successful. I think the latest stuff in the literature and the popular things that people are talking about now are either 3D bunions correction or minimally invasive correction, and both of which we offer those here.
Okay. And then last question I have, what's recovery like for bunion surgery?
Yeah, I get asked that all the time. So most of the time, I would say we can have you walking either the day of or within 1 to 2 weeks after surgery. So it's not like it used to be where you used to have to be on crutches for 6 to 8 weeks. Now we get you walking, but that's typically done inside of one of those walking boots that people see around. So it's not in your tennis shoes, but we get you walking in a walking boot within 1 to 2 weeks after surgery. And so recovery is pretty straightforward now. It's a much more streamlined, and a lot of that has to do with the new fixation that's come on the market. And the other thing I would say is that because we're up to date with the latest and greatest, we offer minimally invasive approaches which decrease swelling. They improve healing times, they improve recovery times. We also offer 3D correction, which is a big thing in the industry right now, where we're actually correcting all the planes of the deformity of the bunion. And so, whereas before and if you go to maybe somebody trained older, may not be correcting all 3 planes of the deformity. So I think those 2 things are critical, and they allow us to recover patients more smoothly, quicker, get them up and walking quicker, which I think is what's important to patients when they start thinking about bunion surgery and getting back to life.
Mm-hmm. Well, great. All right. Well, that ends our our interview, or with some questions for Dr. Waters today. So if you guys have any questions about bunions or would like to have a consultation with Dr. Waters, just give us a call.